So welcome everyone to our webinar today. Today our speaker is Dr. Kenichi with the University of Idaho. She is a small ruminant veterinarian here at the university. And today she's going to talk to us about sheep and goat reproduction, and I'll let you, tell us a little bit more about yourself.
Thank you, Carmen. I was a graduate. I'm a WSU graduate, both as an undergrad and went to vet school there, and then spent most of my career in Troy, Idaho. So mixed practice, saw a lot of different things there, and then had the opportunity to come to the university here in 2017 and work mainly. My main oversight is with the Sheep Center out here at the university as well. So I teach sheep science, animal disease management, and then the advanced reproduction class here at the university. So today I'm going to, I was asked to talk about sheep and goat reproduction, since we're getting into that time of the year. Out at the Sheep Center, we do now have a fall lambing group. So we've been through about 120 ewes already this fall, and then we'll have another group starting in January and February. So the objectives for this webinar today, I thought we would talk about some of the, the prepartum, the issues that we see right before parturition, and then the parturition process, and then newborn management of the neonate, and then some postpartum management of the doe and ewe that are common things that we see. So pregnancy toxemia, also known as ketosis, the pathophysiology of these two issues is very similar. Probably the biggest difference that we see with our small ruminants is that it tends to be more of an issue right before parturition, hence the pregnancy toxemia that we tend to call it. And so it is associated with a late pregnancy. Generally, we're going to see this usually in the last month of pregnancy. I say inappropriate nutrition, and that can mean a lot of things. Sometimes what the animals are being fed isn't appropriate. But the other issue we see, as this diagram is depicting, is that as these animals become, late in pregnancy, especially if they have multiple fetuses, that uterus starts taking up a large amount of room that before then was used for digestion. And so in some cases, the ability for these animals to actually consume enough nutrients becomes a challenge because of the number of fetuses that are there. Certainly if animals get, very low in their body condition score, or even very high, so they're overly fat, both of those can lead to pregnancy toxemia issues. But the more common thing is definitely to see the animals that are a little bit on the thin side, and just not being able to consume the nutrition that they need. Clinical signs. So, again, these can be varied. Generally, what I will notice first in these animals is that they're not willing to get up and go to the feed bunk and eat. And so that's kind of my first thing that I'm looking for with these animals. And if they do get up, sometimes they'll be, they may be a little bit unsteady on their feet. There may be some, muscle twitching. As this disease progresses, we can sometimes see them become painful. Grinding of their teeth can be an indication that things just aren't quite right in their world. So that can be a sign. And then certainly more serious, neurological signs can ensue. So this is a picture of a goat here that is pretty far along in this issue. We, definitely hope that we can, pick this up before they get to this point. Because again, if we can intervene early on in these animals, we can, be a lot more successful of keeping them from getting to the point where they become more of an emergency situation and potentially, die from this disease. So, what to do? Generally, I think we all probably, know that we want to be feeding them, a higher plane of nutrition during that last trimester of pregnancy. And so again, it needs to be a good quality food. Again, the volume, the amount of volume that they're going to be able to consume can be limited. So we need them to have, a low volume, high concentration, high energy type food. So not uncommon then to want to add, more concentrates to this, gestation diet, good quality hay. So, the hay that we're feeding them is not a lot of stem, but a lot of good nutrition in the hay that they're being given. If I suspect an animal is behaving, as I said, maybe a little slow to get up, everybody else in the pen's gone to the feed bunk to eat, and this one is not, I will typically start them on propylene glycol. This product, given orally, will convert to glucose in their system, and so it can be a nice way of being able to support them in their need for the glucose before things start to get worse. Of course, you want to monitor these animals very closely, and then make sure that they're going in a positive way. If they're not, then we're going to need to be more aggressive in our treatment, which might include IV fluids, additional dextrose that we may be given IV as well as orally. Antibiotics, generally antibiotics are only going to be indicated if we suspect maybe an underlying issue that is going on with these animals might be an infectious in nature. Again, we can see the signs of pregnancy toxemia, but there can be, underlying reasons why these animals, develop this aside from, poor nutrition. Being able to assess, blood glucose levels, glucose and ketones, as well to assessing fetal well-being. Are the fetuses still alive? We may be, considering doing a C-section to just get the fetuses out of there, especially if the dam is not responding to some of the therapies that we're doing. Again, prevention is really the key with this particular type of disorder. So ways that we can monitor as well as diagnose. So this is just a monitor that will do both glucose levels as well as ketones. Any of your, glucosometers that you can get at the drugstores, that are there for people monitoring their own glucose levels, we can use in our animals. Generally, if the glucose levels are dropping, the ketone levels are getting higher. So it can be a quick source of identifying, and monitoring these animals. I typically don't necessarily look at blood glucose or ketones initially. Initially, I'll just, as I said, start them on some propylene glycol, maybe some additional dextrose, and then if they're not responding as I feel like they should, then I will do some monitoring, especially to see how they're doing, and especially in those cases that don't seem to be responding as I expect them to be. One of the things I will, caution with these types of monitors, they are sensitive to temperatures. So especially this time of year when it's a lot colder, you do need to warm these things up. So if you're just pulling them out of a drawer in your barn and it's, cold, make sure you warm them up or you're not going to get good readings on them. We've learned that from trial and error. So we talked about prevention with this issue. And so again, good nutrition is, very, very important. We also need to look at other things. If these animals have parasite issues or other underlying disease issues, those do need to be addressed, or we're going to end up, having this issue. Anything that is going to cause stress in these animals is going to increase their need and their utilization of the glucose, and certainly set them up for developing pregnancy toxemia. The idea of shearing these animals, in the case of our sheep, the idea there is by taking that wool cover off, it encourages those animals to eat more to help keep themselves warm. Additionally, too, we can, reduce some of the wool weight that they're trying to carry around. If we are, screening or looking at the beta hydroxybutyrate, the BHBs, which a lot of those, the monitor that I showed you earlier, it will monitor these levels. So if we're starting to see these animals, go above that 0.7 millimoles per liter, that's going to indicate, that these animals are in negative energy balance. And so the potential for them to develop pregnancy toxemia is certainly a reality. If we're looking at glucose, if we're starting to see glucose levels in the blood of less than 50 milligrams per deciliter, that's also an indication that they're in negative energy balance as well. Management practices, again, so, we've talked about nutrition, but again, are they able to get to the bunk space? Is there plenty of room in the bunk space? All these types of things that, potentially might be a problem for them to actually, consume the food. We need to be paying attention to, so that we don't actually, cause this issue. And so I'll talk about an example that we had out at the Sheep Center about 5 years ago. So we have two flocks. We have a white-faced flock, which is our production group, and then we have our Suffolk flock, which is more, seed stock animals, as well as we do a lot of genetic work with those because we have a lot of genetic information on them. So during this time, we had about 80 mature ewes that were supposed to start lambing around January 4th. The week of December 27th, we were having, like daily occurrences of these down ewes that I was talking about. They were slow to get up, not really, responding, normally, but once we gave them some oral electrolytes, and again, many of our oral electrolytes will contain glucose, they seem to respond, pretty well, continue eating and all that. We did have a couple of stillborn lambs occur during this time. So we kind of wondered what was going on. At this time, our close-up ewes that are due to lamb pretty close were in these first two pens right across from the house where the manager stays. And so as they as they would get close to lambing, we would then move them into these lambing pens and then into the lambing barn after they'd lambed. So anyway, we got through the white-faced group, and then onto our Suffolks, and they were to start lambing in mid-January and through the month of February. And again, with the first part of February there, we had 5 ewes that required C-sections associated with uterine inertia, uterine issues, and that we blamed on pregnancy toxemia because we were having issues with low glucose, etc. And the same thing, these ewes were in that same pen. And one day I had, the ability to look at these guys when the feed truck came through. And so in this picture here, we've got, the feed bunk here. They tend to, hang out in this area that's enclosed that we have straw down. But they had to move from the area of the straw through this muddy, gooky, yucky area to the feed bunk. And I happened to notice that, as the feed truck's coming through, most of these ewes, they would get up because they wanted to go eat, but then it's kind of like they'd walk to the end of the straw, look out there in that, mud pit and go, ugh, and then they would just turn around and not go out. So, kind of a light bulb moment there. These guys were so, heavy with, fetuses and late term pregnancy that, they just made the choice not to go eat. And usually this time of year, things are not so muddy. The ground is frozen, and so but this particular year it was warmer, and so it was an issue. And so we moved or changed our policy and actually just brought all of the ewes up into these lambing area here, and that's where they would go ahead and just be during that last month of pregnancy, and they don't have to go through mud. We could, watch them a lot, closer, and problem was solved, and so it has not since been an issue. So again, just kind of the point there is that when something is occurring that hasn't been occurring previously, kind of be sure that you're looking at the whole picture. And again, sometimes the environment changes from year to year. That can set you up for problems that weren't there before. So another issue that we've had a couple of problems with this is rupture of the prepubic tendon. So the prepubic tendon is basically that tendon that runs from stem to stern on the ventral aspect of our animals. And again, as these animals age, or if they've had, trauma, past hernias, or multiple pregnancies with, multiple fetuses, that tendon can stretch out and end up rupturing. And then you have animals that will look like this gal here, or some degree of it. We've had a couple of ewes that, had kind of partial ruptures. The problem is then, there's a lot of abdominal press that is used during parturition. And if the tendon is ruptured, the abdominal muscles are not going to be able to function. And so, some options are, to go ahead and induce parturition, maybe do a C-section. We had one ewe that I was sure she was not going to be able to deliver on her own. She did manage to do that successfully, so we were happy about that. But of course, there isn't really any treatment for this. So after they have hopefully had a successful parturition, they need to either be cold or maybe make a pet, but definitely taken out of the reproduction string. Vaginal prolapses. So vaginal prolapses, again, we're going to see these prepartum. More of a problem in ewes than in our goats. They can be associated with, again, management type environment areas where, if they're low quality forage, so, increase abdominal fill, so more pressure is building, so that can pop that vaginal tissue out. Dusty environments, coughing, anytime they, coughing, we can see, vaginal prolapses. So again, this is something that's going to occur prepartum. This harness that I have on this bottom picture is designed to kind of hold that vaginal material in, and also supposedly allow these animals to go ahead and birth their lambs. I don't necessarily trust it, so we'll usually pull it off of them as they start into labor. Again, this is something that tends to, if it happens one time during the pregnancy, it's probably going to happen again. And so probably consideration to not keep this animal around. Abortion. So abortion can occur anytime during gestation. Early abortions oftentimes go unnoticed because there isn't a lot of material that's being passed. Sometimes we'll notice just some, vaginal discharge from one of the animals, and then we'll do, ultrasound to see if she's, still pregnant, and find out that she's no longer pregnant. Difficulty there is it's difficult to find, the discharged tissues, which are important in being able to, to diagnose this. Common causes for abortion are, the Campylobacter, chlamydia. These are both bacterial issues. Toxoplasmosis, we can see that in cases where you have maybe cats that are running around, might be using the feed bunks for litter boxes, and so that we can potentially get some transmission that way. And then there are certainly some, non-infectious causes of abortion as well. Again, recognizing, in late term, will see the fetus as well as placental tissues. Sickness in the dam, oftentimes, I do not see this in many of the abortion situations that we've had. The dams seem to be fine, but there is certainly that potential. So what to do about it? Well, first thing is don't handle any of these abortive tissues without first putting on gloves. Or even more if you are a person that has any kind of immunocompromised situation at all, because abortive tissues is a high prevalence of transmitting something from our sheep, goats to ourselves. If you can get, the fetus and the placenta, put it in a bag and then submit it to diagnostic lab along with a blood sample from the dam. And this can be your best way of being able to diagnose what might or might not be going on with this animal. Again, abortions can be an indication of a lot of different things, but you definitely, if it's something that's infectious, potentially, going to lead to an abortion storm, you're, best plan, get it identified, go ahead and isolate the animal until you get your laboratory results back, so that if it is something that's potentially infectious, you can deal with that, as well as it may be something that utilizing vaccines, this type of thing can be helpful for, future. All right, so let's move on to parturition. So we want to have, want to be prepared for the time our animals are going to start delivering. So, your supplies, again, a lot of different things that you should have on hand. And some of the things are going to be, based on your own experiences, things that you're wanting to, that you've used before, you like using those. But again, something to take care of the umbilical cords with, sterile lubes, ointments to help with, parturition, gloves, obstetrical sleeves if you're going to be assisting in helping some of these lambs or kids be born. You want to protect yourself and protect people that are working for you. It's nice to have some source of, glucose supplement, molasses, whatever, to support the ewe or doe after parturition. Again, the propylene glycol for pregnancy toxemia. Other things such as, 50% dextrose or magnesium gluconate phosphate type of thing for treating, potential issues with that. Heat lamps to help keep the youngsters warm. Colostrum, always nice to have frozen colostrum on hand. And so I always encourage producers to, always, if you have a ewe that has extra colostrum, maybe one that has a single, you can always get, 4 ounces or so of colostrum from that animal, put it in a baggie, put it in the freezer. And, I feel it's fine to keep it for a year. So you want to put the date on it. And if you know you might be using it right away, it's fine to keep it in the refrigerator. Mineral oil for, if there's constipation issues. I've also used the Fleet Enemas. Pepto-Bismol is kind of my go-to for diarrhea situations in many of my animal species. And then other things that you may need for processing the youngsters. Snares, pullers, so there's a couple pictures here of some lamb snares. I do not like to use chains like we tend to use if we're pulling calves. I feel it's just too much for these lambs and kids. So I like these, plastic snares. I also, baling twine is very effective as well. So I'll use that in a pinch as well. Rectal thermometer, very important to have a rectal thermometer available, or maybe a couple of them, because we may need to have that available for assessing some of these youngsters. And then, of course, a place, for these animals to, after the youngsters are born, it's nice to have a, clean, dry area, good bedding, warm and protected. So mainly, again, against, wind, rain, these types of things. It's also a nice area to, or be able to have a place for the youngsters to be where mom can't necessarily, step on them. At the sheep center, we have our jugs. They're, about 5 by 7. And then in one corner, we have it blocked off so that the lambs can get under into that corner, and that's where we can put the heat lamp. And so that provides some extra warmth for those lambs, and also a place where mom, they can get away from mom and be a little warmer there. So signs of impending birth. So typically, as hormonal changes occur, we're going to start to see a relaxation of the ligaments surrounding the birth canal. And so as this is occurring, the tail head can become a little more prominent. Again, with the ewes, and, depending on how much wool they have on them, is not going to be quite as obvious as we see in goats. Swollen vulva, that will typically start occurring. Mammary gland development, in my mind, is generally the best clue that things are impending, because that mammary glands generally will fill very full and give you that indication that they're close to lambing or kidding. Having good records certainly is very helpful as well. We know their gestation is roughly 150 days. So if, you have good records on when they were with, the ram or the buck, or if you, did artificial insemination on them, then you should have a pretty good idea. So 3 stages of labor. So the first stage oftentimes is there's not a lot seen, because there's a lot going on inside. This is where we tend to see the fetuses start to move around, start to get themselves in position to be born. So as this is going on and it's starting to cause some uterine contractions, so this will usually result in some discomfort or restlessness for the dam. You may see her getting up and down. You might see her looking at her belly. They typically will see a reduction in appetite. They may separate themselves off, maybe displays, some type of nesting behavior. The cervical plug, so that's what this is showing here. So it's kind of a mucus type plug. It has been present, covering the cervix during gestation as kind of an additional means of protecting infections or things from moving up through the cervix into the uterus during pregnancy. So maybe something you see being pushed out, oftentimes, again, goes unnoticed. So then the second stage of labor is where we'll start to see the strong abdominal contractions. We, again, may or may not witness, water bag breakage. Oftentimes this is when I'll usually see a kind of a bag, a balloon looking thing that's hanging out of the vulva. And that's usually, good indication that, there should be 2 front feet following pretty quickly. And so then as we, see the feet start to come out, and then usually followed by the nose. And this will usually then institute, these strong abdominal contractions, because as that fetus fills up that birth canal, that's what's going to kind of kick in that that need to strain on the part of the dam, and then as she's producing these strong contractions, and we should be seeing movement of that fetus through the birth canal and then eventually out. I have a picture here of the fetus that's coming with hind legs first. And so a lot of times people will see this and they'll get kind of excited about it. And one of the problems that occurs with this is that when we have the hind legs coming out, oftentimes there's not enough pressure that's occurred because you don't have the head in the vaginal vault, so it won't cause the contractions, the strong contractions. And so, but if you see those hind legs coming out, if you just gently pull those legs, and then that will fill the butt, then comes into the vaginal canal, that will then produce some strong contractions. And you can, go ahead and pull these guys out pretty easily. So they're not really, an emergency situation. Just pull those hind legs out, and typically we'll get them out pretty easy. So end of stage 2 labor is when the fetus is born, and then the third stage of labor is the passage of the placenta or the afterbirth. And so we usually expect that to occur hopefully right after birth, but certainly within 8 hours of birth, we want that placenta passed. So I put this picture in here just to remind people that sometimes when these fetuses are being born, that sac won't tear. And so, and if it doesn't tear, that fetus isn't going to be able to breathe. And so if you are there and you are tending these things, feel free to get in there and make sure that that sac is opened up at least around the mouth and the nose, so that that neonate can start breathing. We've had a couple of situations at the Sheep Center where unattended births and the sac didn't break. Mom was slow in getting up, and the fetus is suffocated. So difficult birth. So what is defined as a difficult birth? So I've got a couple of things listed up in there, and definitely if I feel like the ewe or the doe is in stage 2, which is generally, we see, these, the front of the feet poking out, we know she's in stage 2 labor. And so I definitely want to see progression occurring. I have 30 to 40 minutes. I kind of get, I like to see 20 minutes. I want to see things moving forward. And so if I'm not seeing anything occurring, then I will quietly, go in, restrain the animal. So typically it's nice to have a helper with you, and I'll have, my protective gloves, clean gloves, and then I'll just start assessing the situation. In some cases, you might have a little bit of an elbow lock, and in this, which is what's being shown here, we've got one leg that's coming well, and then the other one has a little bit of an elbow lock. And so just reach in there, pull on the one that's a little bit behind. Nose was right there, and the kid came right away. In some cases, there will, she's in stage 2, she's working really hard, but yet nothing is showing. And so this is where we can use some of these speculums that I have here. So because again, depending on the size of the animal, if she's a large doe, large ewe, then we can go in there with our hand and feel for things. But in their smaller animals, that may be fairly uncomfortable for them, and so we can use these speculums to pass those through the vaginal vault. One has a light associated with it, so basically what you're doing is looking to see whether that cervix has actually opened up. We have a situation in our sheep where it's a ring womb where the cervix doesn't open, and so we can try some hormonal therapy to see if we can get that cervix to open up. We can see if we can manually get that cervix to open up, but if we can't, then she's going to need to have a C-section. If you do feel like you need to get in there for some intervention, again, you need to be very clean at what you're doing. Use plenty of obstetrical lube. Have your, whatever snares or things that you're going to have available to, be able to help you, especially with, if you have a head back, you want to be able to have a hold of those legs, because if you have to push back in to get that head around, you want to, keep hold of those legs to provide traction as you get ready to pull. These are some of the abnormal things that we can see occurring, and again, we basically, when we're trying, when we have a dystocia type problem or difficult birth, we're in essence trying to assess what's not right. So in the case with the head back, we've got two front feet coming, the head is back. So we would go in there with a snare to get around that head, position the head in the proper position, and then go ahead and pull the lamb out. Again, some of these are fairly simple to rectify, some of them a little more difficult. This one in the middle with the 4 front legs coming, or just 4 legs coming at you, that's probably the most common thing that I've dealt with out at the sheep center. And so the challenge there is figuring out, who belongs to what legs, and then retracting one, getting the other out, and then getting the second one out. And then in some cases there's even more. So again, the challenge of figuring out what belongs to whom, and getting them out is a challenge that way. So again, cleanliness, making sure that, trimmed nails too, if you're going to be doing anything, internal. It's very easy to do some damage if you have long fingernails. So, don't have those. Being very gentle. Sometimes if you're used to, working and helping in large ruminants, we do need to be much gentler when we're working with our small ruminants. And I think too, be aware of your limitations. If you're not comfortable, if you don't have somebody who's has some experience in dealing with difficult births, then make sure that you have a veterinarian that you can call, or somebody that is knowledgeable in helping you, because it's typically not a one-person job. It requires at least 2 people, and in some cases more, to be able to get these youngsters out if there's dystocia issue. Okay, so we've had normal birth. We've got the neonate or neonates are out. So, the first thing that we want to do is check for breathing. So we can stimulate them, usually we'll, clean around the nostrils and the mouth. Then we also want to stimulate breathing through, chest, and vigorously rubbing their body. Be careful. I don't like to swing the neonates, but I will sometimes use gravity if there's a lot of fluid still in their chest area. I'll use gravity to help get that out. This lamb resuscitator that I have a picture of here is really great. It can work both ways. It can work to actually help aspirate fluids from their mouth and their lungs, and then it can also work to help to inflate their lungs. So you can use it to aspirate fluid out, and then also use it to push air in for assisting them. Checking for suckling reflex. We want to make sure that these neonates are, get up and standing, and then that they're nursing within 20 to 30 minutes. And then also check on mom, maybe give her some molasses, and then look at the umbilical cord, the clip, dip, and strip. So clip the umbilical cord if it needs it, dip it in iodine or Chlorhex, and then also strip those teats, because most of our animals will have a little bit of a plug at the end of those teats, which can be difficult for the neonate to get that out and get that first colostrum. So make sure to strip those teats so that there's good free-flowing colostrum available. So this is just some people ask me, well, how long can you leave the umbilical cord? And basically, I don't want them stepping on it. If it's long enough that they're stepping on it, then I will trim it. And so typically, because they can bleed when you do trim them, I'll usually use a pair of hemostats and put that on there, tie it off with some umbilical tape, which is shown here, or some suture material, and trim it off. And then again, have your bottle of navel treatment, and make sure to dip the navel. Get on the care of the doe and you, assessing for additional fetuses. So if you really felt like there was multiple fetuses in there and there's only one and nothing more is going on, it's good idea to assess that. And then also looking for things such as any type of muscle tone quivers, any issues of some of the postpartum things that we'll be talking about. Again, expressing that udder, making sure that the colostrum that's coming out looks good. Appropriate maternal responses, that she's taking care of those youngsters as we would expect. And always a good idea to really monitor them pretty closely for the 72 hours. And make sure there's good mothering up, especially in our ewes and lambs, before they go into a mixing pen. Okay, so feeding the lamb and the kid. So again, the depending on the size of the lamb and kid, this is just kind of a quick little math that we could do to kind of give us an idea of how much they should be consuming. In most cases, if they're up and you're seeing them nursing every few hours, they're probably doing fine. But if they're weak and you're not sure about it, this just gives us something that we can follow to if we've got to milk the mom and then tube feed the lambs, this can give us an idea of how much we need to be giving them. Again, with the colostrum, we want to be feeding them about 4 to 6 ounces every 4 to 6 hours during that first 24 hours. I will try to get them to nurse off a bottle if for some reason they're not wanting to nurse off mom, because I do want to encourage that suckle reflex. And if we do too much tubing with them, we can end up inhibiting that suckle reflex. Checking the belly fill. So that's a good way of looking to see if you're not actually visualizing these lambs nursing, then you can pick them up and just feel that belly. If it feels like there's stuff in there, then they've been nursing. Because sometimes I've had lambs that are up there and boy, they're really going after that nipple, but for some reason they're not taking anything in. And so these are ones that we don't want to miss them, because we're going to end up having problems with them. These pictures are just showing again how you can measure for tube feeding lambs, and then the passage of the tube. So if we do need to milk our dams, there's one picture here of a easy milker. That's kind of a nice way of getting milk to come out. But if you don't have one of those, a 60 cc syringe, cut the syringe part where you would attach the needle, cut that off, and then put the syringe in backwards, and that makes a nice little breast pump. And you can just put that on the nipple and pull back on the syringe, and it'll just suck that milk right out of the udder there, and it works great for drawing up milk pretty quickly. So one of the things that is a common issue with, certainly our newborn lambs and kids, is that they become, hyperthermic or hypoglycemic. So low blood body temperature and low sugar. So again, these are a couple pictures of lambs that are, they're not looking like they're feeling very good. They're depressed. If you were to fill their bellies, they would have no belly fill. First thing is you want to take their temperature. That's really, really important because that's how you're going to really assess, are these guys truly hypothermic? So anything under 100 degrees Fahrenheit needs attention. If you want to look at their glucose, you can certainly, I'll usually prick an ear vein and just get a bleb of blood, and then you can, run it on your glucosometer. But for the most part, the first thing I'm going to do is look at that temperature. So then treating these lambs that are hypothermic, again, if their temp is 100 to 101, but they're depressed, they have an empty stomach, you go ahead and feed them 50 mils per kilogram of warm milk or colostrum, depending on where they're at age-wise. And then I don't usually take these guys away from mom. I'll usually leave them. Again, we have the heated corners for them, but I will continue to monitor their temp, their attitude, and whether they are nursing. I want them up and doing something about every hour. If you find them and their temp is below 100 and they're depressed, similarly, we want to give them warm milk or colostrum first, and then I will put them in the warming box as well, and then check on them generally every half hour to an hour, again monitoring that temp until they seem like they're fairly stable, and then once they're maintaining a temperature above 100 or 101, then I'll put them back with mom. But again, you need to keep an eye on them. And then every once in a while you run into the ones that are comatose. And so these are typically, they're going to have low temperatures, they're not very responsive. And so these are the ones that are very close to dying if we don't intervene with them. But because they are comatose, we can't tube them. So we need to give them some other form of glucose. And so usually these are the ones that we're going to have our bottle of 50% dextrose, mix it with some warm water, and then we'll give that to them intraperitoneal. And so that's a picture of this here. So I'll just prep the area, clean the area, and then just inject that right into their bellies, and then that glucose and that fluid will be absorbed, and then we can put them in the warming box, and then we just need to keep monitoring them. And a lot of times they'll turn around, they'll start waking up, and then once they are able to swallow, then we can go ahead and tube them with some additional milk, maybe some additional dextrose. Some of the things that I have in red there, one of the big things, the most important thing to remember is that they have to have some sort of glucose, some sort of energy source before we can put them in the warming box, or they will start having seizures. So if they don't have some energy before we're asking them to or trying to warm them up, it's not going to work. Again, these warming boxes can be very, very handy, but I have also used 5-gallon buckets of, very warm water. I'll put the lamb in a garbage sack, tie it around their neck, and then just put them in that bucket of water. And of course, you don't walk away from that. And been very successful in bringing some lambs around that way as well. Okay, some other postpartum disorders that we can see in our ewes and does. So uterine prolapses, so this is an emergency situation. Typically, this is going to occur usually right after the last fetus has been born, and that fetus is born, the ewe or the doe gives one more push, and out comes this uterus. And typically what's happened there is that it just it's been a little sticky in there, and so it's kind of just followed that last fetus out. Sometimes though it can occur a couple hours afterwards. So again, as long as everything is looking pretty good, we just clean them up. do epidural and gently put them back in. This is usually something that is going to require a veterinarian to get this done. And again, once it's happened once, likelihood of it happening again are pretty high. So typically a situation where you're not going to keep them in your reproductive string. Retained placentas, again, usually passed within 6 to 8 hours after birth. Definitely retained if they're, hanging on for, after 12, 18 hours. Don't tend to see these in our small ruminants near to the extent that we see them in our large ruminants. But again, I have some things that are listed there, some of the vitamins, minerals, dystocia issues, can certainly set them up to retain these. If they have to have a C-section, we're typically, dealing with retained placentas. So most cases, just applying some gentle traction will help to the animal to get rid of these. The problem in our especially our sheep is that cervix likes to close down on these pretty quickly after birth. So that will be in not help in getting these things out. So this use of high doses of oxytocin actually has been shown to provide some cervical relaxation in our ewes. And I've used it pretty effectively out at the sheep center to get these retained placentas out. So I'll administer the oxytocin, give them about 20 minutes, and then gentle traction, and been pretty successful at getting them to come out. Again, we can, as more stuff comes out, gravity will help, as well as, you can sometimes tie things such as here we've got a towel tied to the end. So just adding a little bit of weight. One thing we never want to do is to go in there and, try to, manually detach these things or, pull aggressively because anything that's left in there can potentially set them up for other infections. And then too, once these placentas are out, just get rid of them. And even in the normal birthing situation, don't let the ewe or the doe eat them. That's not doing them any good. Just pick them up, throw them in the garbage. Hopefully you've got your gloves on, and because we don't need the dogs taking them or the birds getting into them, because the potential for transmission of pathogens is there. So get those placentas in the garbage where they belong. If in some cases, secondary to retained placenta, or just because, the birthing process is not a sterile process, we can result in a metritis or an endometritis. And so this is basically inflammation of the uterus and the uterine lining. And depending on, what is causing some of this issue, it can lead to endotoxemias in very sick animals. So some of the signs that we may see is going to be, discharges. And again, one thing to note is that, the after parturition, it is not uncommon for as that uterus is involuting back to the size it was before pregnancy, it's going to be pushing fluids out and tissues and stuff as it's remodeling in there to get ready for another pregnancy. And so it's not uncommon to have what we call lochia, which is going to be kind of a bloody discharge that comes out. And as long as, it doesn't smell bad, animal doesn't appear to be feeling bad, it's probably normal. But if you notice anything that looks, pussy or does have a bad odor to it, then these animals need to be assessed. Again, treatment is usually going to require some type of antibiotics. The anti-inflammatory Banamine I like quite well because it has antitoxic properties to it. It can make them feel so much better, so they'll keep eating. Uterine flushes, maybe if I'm seeing a lot of discharge, I'll kind of use some flushes just to help the body get rid of that stuff. The use of prostaglandins and oxytocin, those are there to kind of help the uterus to involute and contract and push things out. And then again, vaccine history. This is where it's really important to make sure they are up to date, especially on their clostridial vaccines, because we can sometimes see a clostridial be involved here, which could be problematic for them. Pyometra, so this is kind of the next step past metritis. Again, this is a fairly rare thing. I haven't seen it too much in either dose or use, but this basically pyometra by definition is just a pus-filled uterus. And so in some cases, if these does or these ewes do get a mild metritis, it could end up resulting in a development of pus. And so one of the keys there is that, they're expelling this. In this case, this animal is urinating, but she passed a lot of pussy discharge before she actually urinated. So these are oftentimes diagnosed through ultrasound, and then, treatment is usually through some, hormonal therapies to help that uterus evacuate itself. Again, the ketosis, or if you want to call it pregnancy toxemia, we can see it both prepartum and postpartum. Again, prepartum is associated with the energy that's being expended, to produce those, multiple fetuses. Then postpartum is usually associated with the energy that's going to lactation. And so consequently, we can see low calcium because of calcium that's going to lactation. And so some of the clinical signs are going to be very similar to what we talked about with pregnancy toxemia. And again, a lot of times, we can do blood work on these guys to determine, but a lot of times we'll just give them something like the Cal-Mag-Phos solutions. They contain glucose, they contain calcium, phosphorus, magnesium. So kind of a shotgun approach, but oftentimes we'll cover them on those situations. But and then again too, prevention by making sure that they are on high calcium, phosphorus, so a lactation diet to support the energy and calcium that's going to be going towards milk production. So generally, alfalfas are good alfalfa or good hay for this time. And I think that is it. So definitely any questions. I'm not quite sure how the questions get handled, but happy to field any questions.
Yes, so we do have a few questions that came in. The first one, I've not heard of this, but maybe you have. They asked, what do you think of the red wine treatment? I don't know what that is.
I haven't heard of that either. So
okay.
You said red wine?
Red wine, yeah.
Yeah, so Denise, that question actually came in during your talk on ketosis and pregnancy toxemia. And so it was there in the beginning. I have not heard of it either, but I'm sure it's something to do with that.
Okay. I mean, yeah, I'm just trying to think I know, I guess like the alcohol products and the similarities between that and sugars, and how they're metabolized similarly in humans, but I hadn't really thought about that for our ruminant animals. I'll have to look into that.
Huh. Never heard of it, but it sounds interesting.
Yeah.
The next question was, how long do ewes produce colostrum?
So typically they're going to it's going to start waning and transitioning from colostrum to regular milk over that 24 to 48 hours. So I pretty much feel that anything after 24 hours where there will still probably be some colostrum, at that point it's not going to contain a whole lot of immunoglobulins and be transitioned more to regular milk. So if I'm going to be banking the colostrum, I'm going to typically grab the colostrum right off the bat. And we should probably be looking at it for, quality, just like we should be doing that in the dairy. And I'll admit we're not doing that at the sheep center. But your best colostrum is going to be the colostrum that's first produced.
The next one was they were taught that swinging and hanging upside down, that the fluid coming out was from the stomach and it actually puts pressure on the diaphragm, restricting breathing.
Right, and I agree. So, definitely no swinging. And when I say, if, holding them upside down, I mean, really, to be more honest, it's just lowering their head. If for some, if somebody doesn't have maybe, access to a respirator, or even the the little turkey baster or ear flush bulb syringe type thing, again, gravity can be your friend in those situations. And again, it's not something you're going to leave them like that for an extended period of time. And again, if they've got fluid in their stomach, if you get that out of there as well, then they're going to be usually quicker to getting up and nursing, and less likely to aspirate that stuff into their lungs as well.
Okay. The next question, they've been told, and I've heard this question before too. I've been told not to feed too much good quality feed to a goat in early pregnancy because the kids get too large. Is this correct? And I guess they say early pregnancy, but I wonder if even in late pregnancy.
Yeah, no, actually that is correct. So in early pregnancy, because this is a problem that people will do is, oh, my animal's pregnant. So then they want to put them right on a, like a high quality alfalfa, dairy grade alfalfa. And actually what we find with that is that it changes the pH in the uterus. And so it can actually lead to early embryonic death, for one thing. So that's been, the main issue there. So I typically, again, my recommendation is not to, I don't think it's so much that it's going to really change the size of the fetuses per se. What's going to happen though is you can end up then having an overconditioned ewe, so that overly fat ewe or doe, that can lead to problems going forward as far as the pregnancy toxemia, or just other difficulties because they're fat. Because again, in most cases, the fetal development, the fetal growth occurs at the last trimester. So, in our sheep and goats, roughly that last 6 weeks or so.
So I guess to add on to that, so if you were going to feed a higher quality feed, what part during gestation would you do?
The last trimester.
Right. Okay. They said you mentioned not to pull the placenta to assist it in passing. Is it all right to gently pull to assist the pass? So I guess how would you assist them?
Yes, yeah. So for sure. So yeah, I will, as I'm, when we see these retained placentas, obviously they're staying around so that we can keep an eye on them, and so I will apply traction to them basically every time I think about it. Again, I've this utilizing the oxytocin has been pretty helpful in these animals that have retained placentas beyond 12 to 18 hours postpartum. I don't want to give that oxytocin too close to actual parturition, because there is a potential that if that uterus is involuting and it's very close after parturition, and you give oxytocin, you could potentially cause a uterine prolapse. knock on wood, I haven't seen that happen, but that's why, I'll wait. And if I don't feel like I'm making much progress with getting that retained placenta out, I'll give them, I'll try the oxytocin, the high dose of oxytocin, wait the 20 minutes, and then, do some traction. And I've had about 50% of them just pop right out for me. Then, if they're still being a little bit stubborn that way, then I'll just continue to, apply traction. Again, somebody's walking by, easy to get a hold of the U, apply the traction, and then, I think we've had them eventually come out, in a couple of days for sure. And I am going to be covering them with antibiotics. We've had this last lambing season higher than what I would call normal metritis situations. And so a couple of them, were found actually on necropsy. And so I'm, a little bit gun shy with that now. And so if I have it, again, suspicion that we have any kind of a metritis situation or something that's going to set them up for that, I'm going to be covering them with some therapies to try to avoid that.
Yeah, so there are a lot of questions in here, so we're not going to be able to get to all of them, but I'll take a couple minutes and we'll just ask a couple more. But I have a follow-up question with that, with the retained placentas. Is there any like mineral supplementation or things you can do beforehand that would help with the metritis and the retained placentas?
I mean, I think fortunately in our small ruminants that, like I said, they're not as common as large ruminants, but I do feel like, the common things such as, selenium, and just all of the trace minerals. So, hopefully people are screening their animals and making sure that, that they have good levels of the minerals, in their animals. And so, and then also that, that they're also getting their diets checked to make sure that what they're feeding their animals are also meeting, the nutritional requirements for the animals. If you're dealing with, things again, such as dystocia issues or delayed birthing situation, those are just kind of potentials just because of the situation. And in that case, yeah, if there's not really any, mineral that's gonna, help that, because it's just a sequela of the complication of the birthing complication.
Right. Okay. So one that's come up a couple of times, they're asking about what can cause vastly different birth weights in twins or multiple neonates.
Yeah. So yeah, I think that, that one's that's a good question, and I'm not sure that we always know that. Certainly if there's situations where, if for whatever reason an animal has been, bred multiple times by, a live cover situation, that could potentially set it up. The other, more common cause is more likely that the differences, because they each have their own placenta. And so they're, how much nutrients and things, transport from the dam to the fetus is going to be dictated by that placenta. So it's, how many, placental sites are there, because we do know that there's differences between the, the different neonates. So that's if one has more than the other, then we can see, more nutrients going to one than to the other. In some cases too, just positioned within the, how they're positioned within the uterus, can also have an effect sometimes. And even, again, to the point where one may be, fully mature and one a little bit dismature because of lack of all the appropriate nutrients and developments needed, hormones, etc., for that neonate to develop in the same way as its sibling.
Okay, very good. Here's some questions that are important. Hopefully won't take up too much time to answer. They asked how many days to leave twins with their mom in the jug, like before putting them back in the big group.
Well, so what we typically do is they stay in the jugs 48 to 72 hours. What dictates that oftentimes is when we need the next jug. And then they go into a small mixing pen. So usually they'll go from, the jug into a mixing pen with, say, 4 or 5 other ewes. And so we have our lambs, mom has a number on her side, lambs all have a number on their side. And so then we're going to monitor when they're in that smaller mixing pen that, that everybody is sticking together and that the lambs are nursing, and that everything looks really good. And so they'll typically stay in that mixing pen for a week or more, again, depending on room considerations, before we would then put them into a larger mixing pen, which then eventually, then they're going out into pasture. If there's any issues with the lambs, at 48 hours, whether they're nursing or with mom, then they stay in the jug until, I'm comfortable with them moving into the next larger situation. So generally, 48 to 72 hours should be plenty of time. But again, if you have one that isn't nursing well, a little weak, mom maybe was a little ketotic afterwards, then they stay longer.
And what size jug do you recommend?
So, I like we have some 5x7 and we have some 5x5s. And so with the Suffolks, so they're bigger, and I like the bigger jugs for them. But yeah, it's kind of it's a little bit of a double-edged sword. What's the problem is when you want, if you're trying to evaluate these lambs, you need to get in the jug and look at the lambs. And of course, if mom is a little bit on the, I don't want to say hysterical, but if she's a little bit unsure about all of this going on, then then that sometimes gets her moving around. And then if the lambs are underfoot, then potentially getting them stepped on. The smaller jugs do kind of keep the ewe a little bit more controlled. Does make it a little bit easier to use. We'll use the shepherd's hooks, and we'll use those so we can stand outside of the jug and actually put the hook in, and then hook the lamb usually around like the shoulder area, and then be able to pick that lamb up. And that tends to keep mom a little bit less, upset that we're in there messing with her babies. But so yeah, I like a little bit bigger for the bigger animals, but again, too big isn't going to be very good either, because you really do want that close confines for the mothering up aspect of why we have them in the jugs to begin with.
Very good. There's still a lot of questions, but we're not gonna have time to get to all of them. So Chad, do you have any that you can think of? And I'll address one we've had in here multiple times. This will be posted on the YouTube page within probably a week or so, whenever Melinda has time to get it up. And then I'm sure Dr. Knietche has an email. If you guys have more questions, she would certainly be able to answer those that way.
Yeah, absolutely. I mean, my email's on that first slide, but yeah, if you can Google me or whatever at the University of Idaho, and yeah, feel free to just shoot me questions over email. I'm happy to answer them.
Yep.
I can't think of any specific questions. I mean, there's a whole host of them here, but one thing that I see reoccurring in Extension is the questions coming in about proper vaccination timing. Do you think you could touch that real quick and talk about the importance with that in relation to the colostrum and stuff?
You bet. Yeah. And it's funny because I actually thought about that, but so what we do know is with your vaccines, and especially if you want to have, high levels of immunoglobulins in your colostrum, you want to vaccinate that ewe roughly about 4 weeks, 3 to 4 weeks before you expect her to have her lambs. And that will give her time to, assimilate the vaccine through her system and then produce a good amount of immunoglobulins that will then be passed through the colostrum to the lambs, which will then provide them protection until we're going to start vaccinating them, which is, roughly 4 to 6 weeks of age. As far as, so most of the vaccines that we're going to be using in our pregnant animals should be killed vaccines. And so those are the ones that are safest. And again, many of our, many of the vaccines that we're using are going to be these killed types of vaccines. As far as which type, or which, which kind of vaccines to use. If you have a problem with a particular, disease issue and there's a vaccine available, then that is the vaccine that you should be utilizing. I will say, things such as, the tetanus, Clostridial C and D. So that's the Clostridial perfringens C and D. So that's generally the one we're seeing associated with the overeating issue in our lambs. I think those are pretty, I think those should be used universally. If you wanted to do something like a 7-way, like we give in cattle, I see sheep producers doing that, and I don't have any problems with it, especially, sheep can get blackleg, they can get red water, and it also has the perfringens in it, so as well as the tetanus. So that's fine. Pneumonia vaccines. So when I first started out at the sheep center, they were not giving any pneumonia vaccine. We were only given the C, D, and T. And we had issues with animals dying from pneumonia. And so we started implementing that. And since that time, we have greatly reduced our incidence of pneumonias out there at the sheep center. So our routine vaccines are the pneumonia vaccines, so the Pasteurella and the Haemophilus, and then the C, D, and T. We have some of the others that I mentioned, so the Campylobacter and the chlamydia. A couple years ago, we had a ewe that she was, I think, about mid-gestation abortion. We were able to find everything, send it in, and it came back positive for chlamydia. So we instituted vaccinating for chlamydia, which again, that's going to be more an issue with the ewe. So that's going to be one that you would want to vaccinate the ewe prior to pregnancy, and so she's got good levels of protection during her pregnancy. But then, subsequently, we have not had any more issue with it, and so we have made the decision to stop vaccinating for the chlamydia, and I think we're 4 years out now, and so far so good. So I guess that the take-home point there is I do not believe in just kind of blanket vaccinating everybody for everything, because there are issues. Every time you vaccinate, you're causing a reaction in these animals' bodies, and that can potentially lead to other issues. So if it's not a problem, you don't need to be vaccinating for it. If it's a problem that's going to potentially affect your lambs, like the clostridials and pneumonia issues, then we want that ewe vaccinated 4 weeks prior to parturition, so she's got good immunoglobulins to pass on to the lambs. And you start vaccinating the lambs at 4 weeks, and then again at 8 weeks, or however best fits into your production system.
Thank you so much. I know that's a that's a long answer, but I
Yeah.
appreciate it. So,
Sure. Well, it's a kind of a complicated one, it's
yeah.
yeah, but it's a good one.
For sure. Well, thank you for your time today. This was a great topic to cover.